in case anyone would like to not be recorded or quoted in the summary, please do indicate that on the chat, and we'll take note of that and make sure that you're kind of left out of that. To save bandwidth, if you could please turn your camera off or on, or keep yourself on mute, unless of course you are speaking or asking a question or presenting something yourself. It would just be easier and also make it easier to moderate the session. Please do speak in Hindi or English, whichever you are most comfortable with. We like to encourage people to not feel sort of pressure to speak in a certain language. So we do have time dedicated for questions at the end of the session. So that's how we've structured it. We'd like Professor Menon to kind of go through his presentation, and then we have about half an hour dedicated to question and answers, which will be moderated by Sunita. But of course, if you have something very urgent you'd like to kind of share, please do write that on the chat box, and we'll get to that during the question and answer session. Also, whilst you're kind of leaving any comments or question, it would be nice if you could introduce yourself and your organization along with it, so it's easy to contextualize your question. Next, please. Great. So just a quick look at the agenda. We're at the quick 5-minute introduction, which is where we are, after which I'll hand it over to Sunita, and then Professor Menon, and the question and answer session, as I already mentioned. Next slide, please. Right, so just we'll do a little bit of a recap and an update about CoreNet, and I apologize for some of you who might have heard this every time we have the coffee hour session, but I'll just take a quick 2 minutes. So the COVID-19 Research Network, or CoreNet as we call it, is an effort to build a community of practice to foster and exchange collaboration amongst research organizations, gathering information on issues relevant to the COVID-19 pandemic. So that is the intent with which we have created this platform, and we've been engaging with so many of you with. And the goals of the organization are twofold. One is to kind of maximize impact, and the other is to expand on ethics and equity. And ever since late May, which is when CoreNet sort of came into existence, we have over 40 member organizations working across the country in 23 geographies. We have more than 140 individual members on the Slack workspace, and on a daily basis, we have sort of vibrant discussions, sharing of resources, sharing of events. We also now, as of this week, have crossed the 60 number mark of the number of projects we have on CoreNet, and we have new members and projects being added every week. We also have a series of public and member-only events. One of those is the coffee hour session, as we are hosting right now. We also have another series of events, which is the ethics dialogues. We had one early in August, and early in July, and the next one we have is on the 14th of September, which is in partnership with Sexual Reproductive Health Matters, and we'll be sharing more details of that soon, but just to keep an eye out for those two kind of events we host. So the coffee hour sessions have been planned to be held every Thursday between 4 to 5, and we aim for them to be a space where network members can convene and informally discuss, share, learn about different studies, different tools, methodologies, and just have engaging conversations. But we'd also like to emphasize that we like to co-create these. We like to co-create these sessions. So if any network member or any one of you does have a session you would like to host, or you have an idea of one you'd like to facilitate, please do reach out to us at hello@corenet.in, and we'd be happy to kind of discuss and find the slot where we could host this kind of a session. Next slide, please. Right, and with that, super quick introduction, I'll hand it over to Sunita to just introduce Professor Menon and the session, and then we can begin. Thank you, everyone.
Fantastic. Thanks so much, Nitya. So I'm just going to do a really brief introduction to Gautam, who's really quite the celebrated modeler in the context of COVID. Gautam has been extensively interviewed, and he's on Twitter. So please take the time out, if you haven't already done so, to search him up on the interwebs. So briefly, Gautam Menon is a professor of physics and biology at Ashoka University, as well as an adjunct faculty in the Department of Biological Sciences at the Tata Institute of Fundamental Research in Mumbai. Always nice to kind of hear a little bit about people's career trajectories. He has a bachelor's degree in physics from St. Stephen's College, Delhi, and an MSc from IIT Kanpur, and a PhD from the Indian Institute of Science in Bangalore. Gautam started his career at the Institute of Mathematical Sciences in Chennai, and his research really covers a very broad range of areas. And Gautam, hopefully we can get to learn a little bit more about how you've managed to span so many different fields, from physics to biophysics to exploring science and society. Public policy, has also been one of your interests, and using machine learning, agent-based modeling now to understand infectious diseases. So we're really excited to have you join us and to tell us a little bit more about agent-based modeling and this very exciting initiative that you're leading called Bharat Sim. So over to you.
Thank you, Sunita. Thank you for the very nice introduction. Thanks, Nitya, too. I need to share my slides, so let me just figure out how to do that. Okay, can all of you see the slide? And hear
yes,
me?
we can. Yes,
yes,
and we can hear you. Perfect.
All
yes,
right, wonderful.
Perfect. Thank you.
Okay, so I want to tell you a little bit about BharatSim, which is a project that we started some months ago, really tied into the time that COVID began to expand in India. But before that, I want to tell you a little bit about where I'm coming from in terms of thinking about COVID. So that where I'm coming from is a model that we continue to work on, that we started working on about 4 months ago, called InsiSim. And that's sort of was a precursor to now what I think about as being the large project in which I'm going to involve myself for the next certainly 2, maybe 5 years, which is BharatSim. So this is just to give you a sequence of how my own thinking about these problems has evolved across these past year or so. So all of us, most of us at least, wake up in the morning and begin to look at figures like this. So this is total number of cases in India, and that's Mr. Rijo John has provided some sort of fit to where it's going. And we look at these numbers and they seem larger every day in terms of the new number of, we're already topping several world records at the moment in terms of number of new cases, over 80,000 per day. Our deaths have sort of going up at some rate, but
I'm sorry to interrupt, but we're not able to see your slides changing.
Oh, okay, so that's the problem. So let me...
Okay, hang on, it just changed and went back, so I don't know what that is about.
You can also press play to preview the slides right now. We also see the rest.
Okay, so let me just try it again. Can you see the next slide and the slide after that?
No, Professor, we're not able to see. I think maybe if you do a slideshow, then it's not visible. But
okay, so let me try something else. Let me stop presenting, and then let me try presenting my full screen, because that's been known to work in some other contexts. Okay, that didn't seem to work now. Okay. All right, so now I'm going to try this again. Has it moved to the next slide?
Yes.
Yeah.
Now it's working.
All right, so I think this is the secret to it. Okay, so you didn't, I mean, you heard the discussion. So I started off in InsiSim, and I'm going to tell you about InsiSim first, and then I'm going to get to what BharatSim is all about. And as I said, all of us look at pictures like this. I assume now that you see the graph that I'm showing you on the screen at the moment, with the number of cases rising every day. And this is a sort of worrying issue. Where is it actually going? When is it going to turn around? And this is all India, this particular picture, but the behavior at the level of individual states and cities is far more complex. Delhi went up, came down, it doesn't seem to have gone down all the way, sort of hanging around, kind of more or less steady for a while with little bits of ups and downs. So the question is, if you look at graphs like this, so if you started off looking at a graph of daily new cases as a function of time, and then it sort of did this, and then it did this, and then it did this, the question is, early on, would you have any idea where it's going at any point on this graph? What enables you to know, or with what methods would you know what it's going to do? And this is obviously a very important question. It's a local question. It's a question that states, cities are struggling with. And it's also a pan-India question. And India, sort of the Indian numbers are made up of all of this huge complex of different state numbers, different cities, etc., all adding up to that global figure. So why model this? And the relationship that the Indian government has with modeling is not particularly a strong one at this moment. As the Balram Bhargav said, no model has forecast COVID spread correctly. Kind of true, that really is an issue. And Indu Bhushan, who is the CEO of the National Health Authority, said the conclusion from such mathematical modeling can create confusion and panic among citizens. So, whereas in a number of other countries, the relationship between modeling and public policy and government is actually far more close-knit. Each part knows what the other is doing, and government decisions are clearly informed by what the modelers might predict or what the modelers might suggest. That's a little more disconnected. We have really no idea on the models or the ideas behind which government policy is currently based. But in an effort to understand exactly these sort of trajectories I thought about, we at the Indian Scientists Response to COVID-19, which is a group kind of like yours, but it's bigger. It's between about 600 and 700 scientists, visual artists, doctors, psychologists, drawn from all over the country, who work on aspects of outreach related to this, on science communication related to this, as well as it has a large group now of people who work on both the data as well as the modeling part. And this is a modeling effort that I led and I continue to lead at the moment. So the model here is called InSci-Sim. The InSci comes from the Indian scientists. The Sim is the simulation part. And our work is available on a public website of the Indian Scientists Response to COVID-19. There have been a bunch of reports. The most recent one on July 28th was the Delhi analysis. To come, we've been working for the last month and a half or so on the second version of this. So this is the first version. The second version is much more detailed. I'll tell you a little bit about that, and then we'll go on. So this is a classic, what's called a compartmental model or compartmental epidemiological model. And the idea is to make projections at the level of each individual 739 districts out of India, to put in all of the information that we have about demographics, the age structuring, the distribution of ages in that particular district population, as well as migration between districts, cities, etc., etc. It's also to evaluate different non-pharmaceutical interventions. What do lockdowns do? What do localized lockdowns do? What do allowing people to return to work in a staggered way? What does that do? What does mask wearing do in a generic sense? Can we account for that? Then what we wanted to do was to make this analysis publicly available. So there is an online tool where you can enter the name of your city or your district or your area, enter it, enter your starting guess for these numbers or use the numbers that we have supplied to you, and then see where the model will take you within the next week or 2 weeks. This also includes migration, which is a big issue. Remember that a lot of the disease was seeded in distant parts of the country because of the migrant workers who were confined to Delhi, Mumbai, many other areas, industrial areas, and then moved back over a period of about a month and a half, 2 months, to where they originated from, carrying the disease with them, presumably. We can also model the fraction of the population that is unable to access healthcare, and it's generalizable, it's transparent. And these are all good advantages when you work with models. So what this model does is to try to replicate the trajectory of individual patients through a hospital. So it says there are people who are asymptomatically infected, who can transfer the infection to other people, but will recover without showing any symptoms. There are the mildly symptomatic, there are the severely symptomatic who will go through a period of hospital and then recover. And there are the critical symptomatic who will require ICUs, ventilators, etc. And some fraction of them will die. And the rates at which you apportion your population between asymptomatic, mild, severe, critical, etc. These are numbers that we know from studies in the US, in Italy, in China, and increasingly now from India. So the effort now is to try and get numbers that are much more India specific when we discuss the course of a patient through this. Here is some results. This is what happens in Pune. This is critical active cases, that is cases that might require special hospital treatment. And you can see the dots are the reported data, and you can see it sort of go up. The band that you see is the band that we said would be the optimal band that we predict. And you can see the numbers go up, and at some point, the Pune administration decided that they were hospitalizing too many people who didn't need it. So then you see the numbers fall again, then come back within the band that we prescribed. And that's an interesting thing. Now, which is right? Was the numbers right, the reported data right, or the model correct in terms of that particular reconfiguration? Here are numbers. We work with a group between the Indian Institute of Science and the Indian Statistical Institute that provides input to the Bangalore administration. So these are, again, projections that are week-wise, that they go for 1 week ahead and then we recalibrate the model. And the idea there is to try and integrate this into models that look at the usage of testing centers. Where are the testing centers closest to where a test is done, which might have available capacity, and how does one reach it? So it's a combination of sort of methodologies that look at operations research of getting tests to where they're most required and integrate that to asking where will they be needed in the next few weeks to come. This is the Delhi calculation, as I said, the most recent, and we predicted that the Delhi peak was over. And it's little unclear. We predicted a peak that went down, but why it sustained is a sort of complicated question that we didn't attempt to address, but we presumably will address in another few weeks to come. So these are powerful models. I just gave you some examples, and imagine that we can do this for every district in India with all of the information that we have about that district. As I said, the distribution of people's ages in that district, the distribution of pre-existing conditions within that district, people coming in and out, all of this information we can put into that type of model, and then ask what would be the requirement of hospitals, what would be the requirement of ICU units at different stages, when will it peak, when will it come down, what effects does specific interventions have on that particular region. All of that we can discuss here. So these are powerful models, as I said, and they're pretty much state of the art. This is probably among the best, if not the best model for India at the moment of that class of models. But these models aren't perfect. It's hard to put in the sort of relevant granularity that you increasingly know is important for the disease. For example, network effects. It's known that most of the disease is actually transmitted by a small number of people who are infected, the 80-20 rule. And the 20% of people who transfer the disease to 80% of the people are called super spreaders. It's hard to put super spreaders into models like that, although we know that they're important. The way people respond to diseases, respond to lockdowns, respond to various types of economic constraints is important. People make choices of what to do, to abandon mask wearing, to go out to open offices, etc., etc. So this combination of the nature of the economic stress that you're in, the nature of choices that you might make, and the implications of those choices for how you might behave and other people might behave is something that's harder to put in. Migrations, reverse migrations. I said there were migrations in this, but not at the scale, the sort of multi-state scale, including people moving very slowly and potentially influencing people along the trajectories between, say, Bihar and Uttar Pradesh and Mumbai or Punjab. It's hard to do very localized lockdowns. It's hard to do things like testing variations. Now, most states in India have some combination of the rapid antigen test as well as the RT-PCR. They don't tell you what this combination is. States like Tamil Nadu claim to be doing only RT-PCR tests. So testing variations can cloud the nature of the numbers that are there. It's hard to put it into those models. It's easier to do it in other types of models. Other very important question, what about all of the diseases, all of the sick people who are sick with things other than COVID? What happens to chronic conditions such as that require dialysis, for example? What happens to immunization? What effect will this have on the long term? These are harder questions to address. And there are a whole bunch of things that really are questions that people working in public health might want to ask, but they don't have answers in that class of models. So then you can ask, are there different ways of asking similar questions about the spread of disease that are potentially more general and can give you the answers to various different types of questions with much more granularity and seriousness that you might want to ask? That's where BharatSim comes in. And the BharatSim idea, of course, is an idea that I've had for a long time, but as it happens, moving to Ashoka University, coming into contact with a number of remarkable people here, expanding my reach within sort of the gang of people in India who work in COVID and work in related areas, brought this idea to the fore. And then this was sort of took a life of its own. So BharatSim, I've sort of told you about what I've been doing so far, which is InsideSim. So now let's get to BharatSim, which is really the big idea in town as far as I'm concerned. BharatSim is what is called an ultra large scale simulation of agents. An agent is a computational object that's simulated on a computer. The properties of agents, it'll become clear what these words mean, are derived from a synthetic population. The idea of modeling an individual as an agent is an attempt to model both India's people as well as aspects of its geography, the time it takes to go from one city to another, the barriers that might exist, localized regions of different types of subpopulations nested within populations. BharatSim is a collaboration between Ashoka University, where I am currently, and a company called ThoughtWorks, which works in high-end engineering consultancy, and is particularly sort of knowledgeable about questions like this, how to make simulations like this work. An agent-based model is a model of individuals. That is to say, we represent every individual, for example, in Mumbai city or Chennai city, as one individual simulated on a computer. Because there is a mapping between an individual in a city to an individual on a computer, you can try to put in as much complexity as you think is relevant into the individual that you simulate on the computer. For example, all of these people that you can see, the 60, 70 odd people that you can see in that picture on the top, you could imagine all of these, their motions, their interactions with each other, all of them to be represented on a computer. People do this, for example, to understand how mobility patterns work in cities, how to evacuate stadiums. All of these questions are well addressed using agent-based models because you can load properties onto these agents that are, in a sense, much more representative of the way people actually behave and the decisions they actually make than other types of models. So the most immediate use of BharatSim would be to model how COVID-19 spreads and to assess mitigation strategies and their costs. The basic idea is that if you have one agent who's infected, they can infect an agent who's susceptible, and then you can ask how the disease spreads. And all of this, all of the properties of the disease that you know of can be encoded. You can make some fraction of your population a super spreader and ask what is the consequence of having a super spreader? What happens when people begin to use public transport and begin to move back and forth? Do infections spread within schools, and to what extent do they spread within schools? And over here, as we learn more and more about the disease and how it transmits between different segments of the population, different age groups, we can be much more specific about the choices that we make while we're modeling. But the idea of BharatSim is actually still even broader. It's not just COVID-19. You can ask of it many questions that are generically public health questions. You could also ask social science questions. You could ask economics questions. And that's where I think the power of BharatSim really is in the long term. So there are three main parts to BharatSim. And one is the computational part. How do you assemble the computational infrastructure, the computational programs, the techniques, the databases, etc., to be able to simulate a large number of agents? When we say BharatSim, I mean the ultimate aim of BharatSim might be, in a very, very sort of rare instance, to model all of the 1.38 billion people in India. In practice, we'll only do that for bragging rights, and I doubt it's even feasible with what we have now. The idea would be to simulate even a number like 100 million people together, and then ask, can we say something about how disease spreads? By 100 million, you're sort of looking at 5 Bombays, or Bombay, Delhi, Calcutta, state of Maharashtra, etc., etc. And that's good enough to answer a whole bunch of questions that you might have that are very specific about disease. The second thing is how do agents interact? And about this we know far less. And this is a complicated question anyway. What are the sort of people that for example, how much does a person who works at home, who do they interact with? Presumably just immediate family. Who does a school kid interact with? Presumably their school, maybe the kids within the playground during lunch hour, etc. Depending upon your occupation, what is the spectrum of interaction that you can have? There are people who meet many people, for example, healthcare workers, policemen, vegetable vendors, etc., etc., people who contact a large number of people during the course of their occupation. Can we account for those networks when we describe agents within BharatSim? But the last part, in a sense, is the most fascinating of all of these. And that's a question of how do you create a synthetic population that describes agents? And that's where, in a sense, I had initially thought of this as being just a minor addendum to the rest of the BharatSim agent-based program. But in a sense, this is now taking on the shape and attributes of being probably the larger part of this and the more complicated part of all of this enterprise. It's not as though this hasn't been done before. There's a number of other agent-based models in the market, but they all tend to be optimized either for the US or for the UK, parts of Europe. Singapore has a very detailed agent-based model by which they model all of the 5.8 million people who residents in Singapore. The synthetic population for India and agent-based model that is constructed precisely for India purposes doesn't exist so far. And certainly at the stage and complexity at which we're thinking of it, it doesn't exist at all. So what information do we need to do this? Certainly census and demographic data, how many people in a state, in a district, in a sub-district, what is the distinction, what number of men versus number of women, what is the distribution of ages, what is the distribution of healthcare accessibility through NFHS data, immunizations, all of this information is there, which must then be tied together by integrating a whole big bunch of different databases together and extracting the knowledge and representing them into realistic people. This is harder than it sounds. And it's harder because it's easy to do a dumb job of this. Take census data, take this data, take that data, put it together. And then you wind up with things that obviously don't make sense. You will create a household with 4 people who are under the age of 5. Now that doesn't make sense. So you have to make, and you don't want to go through a file that is 100 million lines and try to see which makes sense and which doesn't make sense. So that's where modern computing technologies come into play. And that's where you can say, how realistic can you make information that you aggregate from various databases and put them together? So I said agents have attributes that you take from a synthetic population, and some of these are relevant to disease and to public health. So one example, you can say here, each individual has a unique identification. So there's an individual ID. The individual is male, they're 63 years old, or you can say they're between 60 and 70 years old. There's a house ID that tells you where they stay. There's a work ID that tells you where they work. So you can attach locations or geotags to each of these things. There's a family ID that defines the number of people who have close family contacts. You can say things about their education based on your statistics of your population. High school education, earning less than 5,000 per annum. So that's where all of the other economic indicators might come in. There's a pre-existing condition called diabetes. All of these are taken from surveys that are done on the population and then assembled into this model of a synthetic population. And then you can add further things if you know about how the disease is increasing in that particular area. What is the likelihood that this person was infected? What is the gap between being infected and being tested? what, after being tested, what is the likely outcome for someone between 60 and 70 with diabetes who works in hard agricultural labor. You put all this information in and then ask, what is the nature of cases, how many ICU beds will be required, where are the hospitals to which these people can be sent, given the density of hospitals in that region, and so on. Of course, this is a very particularly nice picture that I like. This is a picture of the population density of India. And you can see the whole Gangetic belt, these very high peaks. You can see a huge peak around Mumbai, peak around Chennai, peak around Bangalore, a bunch of other South Indian cities and North Indian cities. Delhi is a very substantial peak. So how do you deal with numbers like this, and what do you do? Well, one answer is just grid India into little pieces. Organize it, for example, a 10-kilometer scale, a 1-kilometer scale, a 100-meter scale, a 10-meter scale, etc. And you might want to have a very, very dense, compact description if you want to look at Bombay. But if you want to look at a much less populated part of the country, say the interior Madhya Pradesh, you might be satisfied with a 1 to 10 kilometer resolution. So the idea is to use information from remote sensing, satellite data, to try and identify the population densities within these regions, and then look at where they overlap district to state boundaries to try and understand what information can we get from the standard databases that exist to be able to construct the synthetic population at that scale. I want you to look at this picture for a little bit. This is the picture of a gentleman looking straight out at you. He could possibly be Indian, we don't know, but there he is. What I want you to do is to look at the next slide. And the next slide tells you the URL, the web URL associated with that photograph. And the web URL says, is https, thispersondoesnotexist.com. And the reason this person does not exist is that this person is made up using machine learning techniques from a composite of a very large number of pictures that were fed into this particular software. It's an extremely realistic thing, and it's not done in a dumb manner. For example, if you try to do that with me and just replaced my beard with a flowing blonde beard, that obviously would create some amount of dissonance. So exactly how to create a realistic looking person that one might look at and say, this really is a real person. That's a trick that involves pretty much frontier methods in computing and in machine learning. And that's the sort of technique that we'd like to use here when we construct a synthetic population. So first of all, can we use machine learning methods? This is a sort of what used to be called AI earlier, but to integrate these different data sources and do something that actually looks like something real. So the idea is that you should be able to take one chunk of our population, let us say the synthetic population, let's say a synthetic population for Bhopal or Nagpur, and run statistical tests on this. If this is done correctly, you would not be able to distinguish our data from a real survey that you would actually do. Of course, you might ask many more questions in that survey, but which we don't put into the synthetic population. But the ideal synthetic population is one that you cannot tell apart at a statistical level from a real population that exists. So this is with Debayan Gupta, also at Ashoka University and at MIT. He is looking at the question of how do you integrate these databases in a sensible manner, including gender, distribution, sizes of families, socioeconomic data, healthcare access, etc. All the information that is currently available, it's all very fragmented, it's all over the place. So we're also looking for people to help us simplify this, attach it together so that things like NCDC data and so on, we can actually put into some form that we can use. A bunch of challenges here, sort of it's time for me to finish up. First of all, this is something that hasn't been done before. And how do we make a synthetic population representative of India? I imagine that many of you are certainly much more experienced than I am in the difficulties of going out, running surveys, looking at health data from various remote parts of the country. And you know how difficult it is to extract that information or to understand it. So we rely, this method doing this relies on the kindness of a large number of people who are willing to contribute the data that we can then integrate into the synthetic population. There's a computational challenge, which is what data structures, what sort of computing and methodologies would you need to be able to simulate the agent-based model? And as I said, this is a very large, I mean, it's pretty much at the boundaries of what can reasonably be done. It can't be done on a laptop or at least for the India population. But the idea would be maybe can we run the population of Pune on a fast laptop or a desktop, at least for some, for some useful purposes. And we can reserve the really large scale simulations for supercomputer level or multiple computers that are attached together. Where do we get the data we need? We're still looking at this, looking at multiple data sources, relying on people to identify data for us that we can actually fold into this. The curation challenge, how do you trust the data that you're getting? What is good data? What is not good data? How do you update the database as people give you more and more data? Again, a very interesting question. Having done all of this, how do you visualize data? How do you make useful the best way to really look at data is not to look at dry graphs, but to look at colorful animations, images, etc. Because we are very visual people, and the neural networks in our head are extremely optimized to detect patterns inside data if it's actually presented to it. So one part of what is being done with the ThoughtWorks company is to develop better visualizations of the data that the computer might output, as well as the synthetic population might provide us. How do you make a program that is flexible? You don't want to have a program that is written in stone. If you find a better way of doing things a year or two down the line, you want to do that. You want to update the synthetic population, all of this. Finally, this is something that doesn't make sense for just me to be interested in, a couple of my friends to be interested in. How do we make people interested in what BharatSim can do as such? So now that I've described it to you, what is it that it can do to help you? Can you run queries on this that may be useful to you in planning further on? Can you look for correlations in data across different regions of India? And to what extent would that help in what you do? And how do we get you interested in collaborating with us? Finally, because we're a university, can we make BharatSim, can we design sort of the future life of BharatSim in such a way that students, not just at Ashoka, but anywhere around the country, can contribute specific models, specific pieces of code that can then be checked, tested, and integrated into this larger scale that is BharatSim. So I hope the point that I wanted to make was, first of all, as a scientist and sort of as a person who believes very deeply in the sharing of data, the BharatSim program and the synthetic population that we construct will be freely available for use by anyone. So it'll be there, you can download it, you can run the programs, you may be able to run the program on our server, or you can query the population for the sort of variable that you're interested in. And the sort of last point that I wanted to make is that large efforts like this really can only succeed as community efforts. They can only succeed if there are enough people interested and willing to contribute to it, to help out, to try and understand it, to say that, look, I know of where data might exist that would help you fill this little hole. You don't know enough about the Northeast, but let me tell you where you might get sort of data that you can put to the Northeast. Or people, for example, have been talking to the biodiversity portal people. So again, they're very interested in making data publicly free and available. So then the question is, can we look at where the next zoonotic outbreak might arise by looking at regions where mankind is infringing upon forests possibly rich in bats and so on. And these regions are, of course, hotspots for crossover events, for spillover events, in which something, some virus that only infected bats and until then might then begin to come into closer and closer contact with humankind. Where are these regions? How do we identify them? How do we understand the relationship of man with his or her environment? How do we understand how diseases spread? How do we ask these questions in a modern manner, really, given the complexity of this country? Are issues that I'm interested in, and I hope I have managed to convey some of that interest to you. So I'm happy to take questions at this point. That's all I had to say.
Thank you so much, Gautam. I'm pretty sure you're a brilliant educator. That was in, I think, less than 30 minutes, a fantastic introduction and tour through, the power of the modeling efforts undertaken by the Indian scientific community and the BharatSim. So I'm wondering if folks who are online have questions or comments or reflections. We have a number of participants who have been involved in collecting and conducting large-scale representative surveys across the country. So I'm wondering if any of you have reflections and reactions to this initiative.
I have to say this is Sonal Desai, NCER and University of Maryland. I have to say this is absolutely fantastic presentation, and I really enjoyed it. One of the things that might be very interesting for some of us would be if you can point us to a website where we find out what level of data aggregation you have used, where they have come from, because there may be some interesting sort of overlap around data that might be feasible.
So we don't have this yet, because as I said, we've just, we're sort of intensely working on this. Within another month and a half to 2 months, we should have a website that describes in detail our data sources, where they come from, our methods, etc. And the timeline is fairly tight in the sense that we have our funders. The program has to be developed within 9 months, and there are lots of milestones in between. The synthetic population, we made a lot of progress with so far. So hopefully within about a month, I think we'd have one realistic version semi-realistic version of a synthetic population. And this is just going to improve. So I promise you this will be up. We don't have it yet, but it's certainly an important part of what we want to do. We want to make this available, the information about BharatSim available as soon as we can. So as soon as we have something, we will do this, we will put it up.
I wonder, Sonalde, if you want to take a minute to describe the India Human Development Survey. I don't know if everyone here knows about it and if Gautam knows about it, because it's a huge resource as well.
India Human Development Survey is a panel study where we began in 2004-5, 11-12, and we will go into field as soon as it's feasible to go back into the field. We follow the same households over time. And the thing that has sort of struck me was that one of the biggest challenges with COVID that came about of return of migrants that became so unexpected, there are a number of behavioral aspects to it that we actually don't have enough data on and couldn't have thought of. But we see ourselves sort of picking back on it when we go into the IHDS round 3. Specifically, the whole migrant challenge. It's not really, where you were born and where you are living now that's going to give you the data. What's needed is really, it's really the solo male migrants who have left their places of origin, who were going back, which was causing some of these challenges, right? And to sort of pick up on this very specific kind of phenomenon, censuses can't very easily do it, but surveys like ours where, you can tweak these things would be feasible. So that was one of the places that we were sort of looking at getting to in future.
So if you have that information, we can actually simulate what happens when you have a bunch of people, maybe 1% of them or 0.5% of them is actually infected with COVID-19, and you know where they came from. So we can simulate what happened when they went back to the villages where they came from, and then ask how might things have spread? What was the delay between their going back and the disease starting off? What potentially interventions could have been made at that point? I understand that some regions did ensure that people who came in from the outside were quarantined, at least even within the village. This has happened in some forest communities that I know about. So they've managed to be protected a little bit. It's not a generic statement. So these are things that we could do because it's easy, since these are people that we model, it's easy to model people going back to different regions, where they came from. If you have some idea of where they originated from and where they came from, we can put it into that model and ask these questions. What was the likelihood that they took COVID-19 back with them?
So Gautam,
again, I'm very interested in data, so I'm happy to discuss more. Sorry, go ahead.
We're getting questions. So Madhulika Khanna. Madhulika, would you like to come online and ask your question?
Sure. So this is coming more from a place of ignorance about these AI methods and agent-based models. So to undertake city-level predictions, for instance, for city of Pune, as you described, do we need data that is representative at that level? Because a lot of our publicly available data sets are at most representative at the district level and usually representative at, say, NSS region level or the state level. So how do you address this in your agent-based models?
So this is going to be a problem. So what we can do is we say, so Prabhag-wise or sub-district wise or something, we have an estimate of what the population is. And from survey data, other types of government data, we have an idea of some of the demographic parameters, the male-female ratio, the age distribution, etc. So whatever bit of information we have on whatever survey exists is useful to us, because then we can piece together in this particular region, this is all of the information that we can load into the agents that we define. We can then see the other advantage with these methods is that you can see if it generalizes. Is a slum population in Bombay, could that be used to model a slum population elsewhere? Are there similarities or connections between them that are useful at the 0th level? Can we use further data on some populations in Delhi to say, let's improve the model that we have to represent that particular part of it better? So the idea behind this is every bit of information goes into improving the model. Every bit of information goes into getting you a better synthetic population. And of course, with Pune, the Pune Smart City, I think, is also planning a somewhat more extensive survey within Pune. Of course, how much of information you will get in cities vis-a-vis remote districts is a different matter altogether. But ideally, I think everyone now understands the importance of having data. And the problem is that in many cases there is data, but it's held very tightly. typically with a government source. And in many cases, there is a lot of data out there, but A, it's in a form that's impossible to figure out because it's sub PDF file that no one can read, no one knows where it is. It's taken down from a website almost immediately. So one part of it is just finding out where that data is and having people do the terrible job of extracting numbers from that and putting it into a form that a computer can use in some way. The other thing is just more awareness about what data can do if used sensibly and integrated into a program such as this. A very good question.
Priya, you want to go next? Sorry, Madhulika.
I was just saying that the government of India did the SCCC survey in 2011, which some academics have access to. Perhaps that is a good first step. It's an individual level data source.
Okay. Yeah. Thanks.
Priya, do you want to go next?
Sure. Thanks, Gautam. I have had the privilege to hear you twice. I'm from the foundation. I had a couple of questions. From what I've understood of the work that you're doing, I have to say that I'll have to read the presentation again. I wanted to know how susceptible was your simulation and your work to original data quality? And iteratively, how do you build any kind of correction model, correction in the quality, in the errors? Like, how do you understand and capture them? And my second question is, can you crowdsource this data from individuals who want to volunteer or an alter ego or whatever? So 2 questions. Thank you.
Okay, so the first question is that in the earlier model that we did, the InsiSim model, this really is a question because you have to benchmark your data against something. We chose in our sort of most recent line of work, we benchmark it against our predictions for the number of deaths versus the actual recorded count of deaths. We know that that's wrong because deaths are overcounted. We only assume that they're not overcounted by a factor of about 30 to 40. If you look at cases, our predictions and pretty much anyone's predictions will say that you're undercounting cases by a factor of at best 10, at worst somewhere between 20 and 50, depending upon which part of the country you are. So those errors are very large, and hopefully basically concentrating on predictions for death, the number of recorded deaths, and benchmarking the model against that will do a better job. But these predictions, especially for COVID-19, where it's going, etc., are data dependent. So we have large bands on any prediction that we want to try and make, and we try not to predict too far, and we try to put in whatever uncertainties we know about. We prefer, for example, to have our predictions lie above the true number of recorded deaths, because we know that if you actually accounted for them correctly, that number would float upward by a factor of about 2, maybe 2.5. So where we can, we try to account for this, but that's certainly a very good question. Crowdsourcing data, a great idea, and we just have to figure out the right way to do it in a way that's trustworthy, in a way that we can say that, look, we trust the data that is crowdsourced and put into this because this is the methodology that was followed. For example, it's nice to get children involved because children are sort of great, especially at the right age. They're extremely enthusiastic about doing things with the right direction. There's a lot of information that involves the community, involves parents, involves schools together in trying to construct a resource. I have no idea how to do it, and all of you are much more experienced than me in this, in trying to do this, but I'd be happy to discuss this if there's any idea that you might have for how we could crowdsource data like this.
Rindulia, would you like to ask your question?
Thank you so much, Sunita. So my question is a bit of an extension to Priya's earlier question on crowdsourcing. Just to understand how can sort of organizations like ours, I represent LEAD at Korea University, how can organizations like us sort of contribute to what the work that you're doing, especially given that most of our studies range between 2,000 to 20,000 respondents. So they're relatively small scale when you look at perhaps simulation, but is there scope for collaboration there, and how can we help essentially?
So data that you collect, once you collect the data, once you write the paper, it just sits there, and it's sort of typically there's a lot of data that is just sitting there doing nothing. For us, that data is important and valuable because if you just look at a population, you sort of study factors of them that even if it's is geographically nice, localized. So now we know something about that little geography that we didn't know earlier. And we can thus design a much better synthetic population for that region. We don't have to know where the people stayed, what their names were. So you can anonymize many parts of what you actually studied. But what is most important to figure out is the correlation. How many people in this age group go to school? How many in this group have a disease that you're studying, for example, or a sort of pre-diabetes? It's these correlations that are that can only be obtained through surveys. And if data that you have that you've collected, you may think it's not useful because the work has been done, it's there in some Excel file somewhere. But all of this will likely find use somewhere within BharatSim. So we'd like to know, once we have a web page, once we sort of are in a position to tell people, to advertise to people, what is the sort of data that we're looking at, and what are the regions that we feel we have relatively little data for. We'd love to have input from you and then see how this can be added. I'm sure we'll have a large number of people who we will collaborate with, acknowledge. And also, if you think that you can use the BharatSim program, but 20,000 is very easy to simulate. That is, it takes practically half a breath on a computer. You can try and collaborate with us or figure it out on your own, how you might ask questions of your data using the simulation that you could not do otherwise. And that would be an interesting thing to discuss.
Thank you so much.
Fantastic. Arushi, would you like to go next?
Sure. Thanks, Sunita. Hi, Professor Gautam. This is Arushi from Dwara Research. I'm really sorry if it's too a question, but I was very curious to know, how did you manage when you were collating different data sets while building the model? How did you manage or tackle with the temporal differences, the frequency of the surveys, while sort of condensing or crossing data sets?
Your voice got broken up a little bit, so I missed the important part of the question towards the end. I did get the earlier part. Sunita, did you hear the whole thing?
Yeah, so the question is how you and the team tackle the temporal differences between the various data sets that you've used to build your model.
Okay, that's a very good question. And of course, everybody relies on the census of 2011, which sort of makes no sense now, 9 years later, but that's the only number that we have. Even if you ask how many districts there are in India, this is the question. It's a number you get answers on government websites that's anywhere between 728 to 736 to 740. So even very basic data isn't available, and what data that exists is old. To some extent, one can make projections, and the Niti Aayog does have projections for what the numbers are now based on what they were earlier. But this is a problem. I mean, there certainly is, you are trying to integrate data over a span of about 20 years, and it's not clear that what numbers you might figure out now have any relation to what that number was earlier. But as I said, the process of developing a synthetic population is a process that can be improved. So all you need is one new survey. All you need is one new large-scale census, some new information about that region, which you can use to improve that prediction. And you can use information from other surveys nearby that are better quality, more recent, etc., to try and say, can I compare these two populations? Do these look statistically similar? In which case, can I do what's called transfer learning? Take what I've learned for this and then move it to this population. And that's a prediction. It may not work, but that's a first cut idea of what might be true for the data that you can then go and examine. And the most important thing would be to go and say that, look, this is completely wrong. The real data has no representation, no relation to what your synthetic population said. Because then we know that something is wrong. We need much better data for that, and then we can see how to get that. So this should be thought of as something that's continuously evolving, and it will get better. The way it should be made so that it can be constantly take an input and constantly improve, and hopefully we'll get to sort of a really something that you cannot tell apart from the real thing in some years' time.
Super exciting. Shantanu, would you like to go next?
Yeah, sure. Thanks, Sunita. And I completely agree with Shonal and Sunita. It's an excellent presentation. So just one clarifying question. So you started your presentation with the India SCI model, where you mentioned about this compartmental models, where different individuals constantly moving from one compartment to another. So that I see more of an aggregate level model. But then when you shifted to the BharatSim model, so you started talking about the individual level model. So I think that's the basic difference, where you try to model different epidemiological phenomenon, for example, say transmission rate, perhaps differential transmission rate across the different age, sex group, etc. So that's the basic difference, I guess. And another point, so someone asked about the representativeness at the lower geographical level that we often don't have in our survey data. But often our survey data also comes with the survey weights, which is essentially the number of individuals it represents. So basically, it's a similar type of individuals that one survey unit actually represents. We may also actually can, I mean, not that all survey data comes with the multiplier, but NSS does, and NFHS, I don't know, for some reason they normalize the survey weight. I don't know why they do that. But basically that can also be incorporated while simulating the population that you want.
I agree. So given a small series survey, how does it extend to larger numbers? Is there a multiplier that you can do? Given some information about the nation. So that's certainly, these are things that we will do in the calculation. So that's all planned in the scale of what we have to do. And that's, that's, one has to do that exactly for the reasons that you point out.
Thank you.
Great. Any other questions? If you do, please just let me know in the chat or turn on your video. While we're waiting for others to chime in, Gautam, I'm wondering, there are already, I see via the chat and the comments, there are a couple of groups who clearly sitting on those data sets that you talked about, who have a stash. And I'm wondering if you could talk a little bit about kind of it's very tactical, but the mechanics of, data flows, and data sharing with you. Like what are the outlines of that process?
So we haven't talked about this in great detail yet, but okay. So one thing, of course, is to ensure that confidentiality is not disrupted or not breached in that. And in a sense, once you strip away personal identifiers, people who stay at home, and you just give us a list of ages, list of the things, and and you say, this is roughly this area, it's impossible to go back and locate that person once you remove. And that's all we need. We can assign geographical locations for our own convenience. We know high population density, low population density. It's these other variables and how they interact with each other that we don't know about. So one thing we can do, and of course, working with computer scientists, they're very, very careful about data security, data privacy. In fact, Debayan is the person who's an expert on privacy of data. So that's one thing that you should not have a worry about. All of these mechanics will be completely sorted out when you share data. So how is it to be shared? What are the mechanics of that? We haven't reached the point where we can begin to connect with individual people and say that, look, this is how your data could contribute to this particular part of our understanding for this synthetic population. Can we help? I hope to be able to clarify all of this within about a month, as I said, a month and a half. Until then, we're still going to go by the large-scale government databases, census, Niti Aayog, various ministry reports, etc., to construct the broad base of the population model that we use, synthetic population. When we reach the stage of how to make that more specific and to improve that, that's when we will need all of the information that we can get. So, don't hesitate to write to me. I'm gautam.menon@ashoka.edu.in, whether about this or anything else. I'm happy to clarify. But some of these questions I will be able to answer a little better when I understand them better myself.
Right. I see that my colleague Priya has another question.
Sorry, Gautam, it was on my mind all along. I wanted to know, when we use data to create synthetic populations, originally when we sought consent for the original data from the source, that respondent did not know where this data and how this data was going to be used. So even though you may do all the protections at your end, how do you deal with that process of original consent for which you have no control?
So I guess it depends a lot on what form what they signed up to what usage they actually did, and is it okay to represent aggregate data? I mean, this now it looks as though it's individuals, but that individual information that goes into the simulation model is really made up of an aggregate statistical information that anyone could have collected. So it's not, so their data goes into this aggregate distribution of people across ages, aggregate distribution of male versus female, etc. This is a question that I have to think about and sort of consult my own IRB. I think it depends very much on the nature of consent that was got. Usually they're very specifically for a specific study, but whether aggregate data comes under that same, and whether once you remove any personal identifiers from it, whether it's usable at all, I don't know. I have to seek my IRBs. Actually, I am a member of the IRB, so I should actually do my own reading up very carefully about what this is. Look at specific consent forms that are signed and look at this thing. And I'd be grateful for any guidance that you might have on this.
Yeah, I think this is the way science is advancing. Then when we seek consent, I think it is useful to add a disclaimer on the potential use upfront for all. And this could be an advice as we go forward. Because you're right, like in a way, it's not bringing harm. You're not even being able to locate it back to the zones in which it was generated based on the question that was asked. I do feel, for me, like looking at that face, that alter ego, is a bit scary. I'll tell you why, because there is a person who looks like this, who's walking the market on Instagram. And so I do worry about that, but that's my own predilection or dilemma when I look at that. But I think like having some kind of a clause or disclaimer is important, and it's in the discussions that we hope to have with IRB committees, we should discuss that.
Yeah. No, that would be nice. And thank you for the clarification, because this is something that does need to be clarified and understood. To what extent can we use data collected for some other purpose, even though we are sort of, it bears no relationship to, you cannot trace back to the individual of anything. To what extent is that valid, doable? To what extent will IRBs permit this, and so on, is something that, again, one has to understand.
So we have 2 minutes left, and we have two questions that are kind of similar, actually. So last question. Can the model take into account unpredictable behaviors, in that, for example, a migrant worker might choose to not return due to personal experience? What would be the implications for simulating behaviors with respect to COVID, keeping in mind the rapidly shifting behavior? So this idea of dynamic behaviors and unpredictability.
Great question. And that's really, that's why agents are very powerful, because an agent is sort of philosophically is something that can change its behavior based on input. So you can have each of your agents make a decision based on some preset threshold. If, for example, they sense that the number of cases in their region is going up as reported by more than the threshold, then they will choose to stay, to self-confine, to stay at home. And you can choose a whole range of different types of behavior for people who, you have to put in a little bit more from the outside. How do people respond? What do people do in particular circumstances? What is the range and variation of behavior? And often it might not make sense to do this India-wide, but to very specific population about which you have a little more information. So you can do this. So that's exactly the point, that with agents you can do this. You can make an agent respond to the information that they're getting from outside, and to make a decision contingent on that information. And this decision can be different for different agents and different for different people. So exactly what you're saying can be done.
Okay, so on the dot, 5 o'clock. This was one of the most engaging coffee hours I've participated in the last 6 months of lockdown. So thank you so much. This is really exciting. Just to let you know that CoreNet, we are also starting to explore how we can facilitate, the sharing and exchange of data across and within the network, because we have a strong belief that data are a public good. And the Gates Foundation is also at the global level working with, for example, the COVID-19 Therapeutics Accelerator and so on, facilitating these kinds of data flows. And so there's some very innovative mechanisms that are being developed, including, mechanisms that address the issues of consent that Priya was alluding to. And as part of the network, we are also looking to foster, new ethics norms, in a sense, based on what we've learned from COVID as a community of practice. So I think there's a lot for us to learn and to co-create. It's really a journey that we're all on. So we'd love to have you back, maybe in a month when you have some more answers, and we can continue the conversation. But I think you've piqued all of our curiosities. So we will send out a note to everyone as a summary of this coffee hour. And last plug, I see Rohan's. Yes, we have sent out across CoreNet a call for interest in submitting a paper to a supplement to the British Medical Journal Global Health on technology to improve measurement, learning, and evaluation, primarily through the use of phone surveys. So if you have done phone surveys, which almost all of you have, and you have insights ranging from methods to sampling to ethics, etc., that you would like to write up, and you'd like to collaborate and team up within the network as well to write a paper, join us for next week's coffee hour.
Let me thank all of you for your attention as well from my side. It's been wonderful talking to all of you and great questions. And I hope to sort of intersect with some or all of you at some later point. Thanks,
Fantastic.
Sunita.
Well, wishing you health and safety. And goodbye, everyone. Till next week.
Bye.
Thank you.